is Lauren. I'm going to be your nurse practitioner today. Today we're going to be doing an exam of your head, eyes, ears, nose, and throat. So first we're going to start with the vision exam. So first I'm going to have you take this chart and hold it at a distance about 12 inches from your face. And then can you read the lowest line that you can read with both eyes open?
LTFPH.
Okay, go ahead and cover your right eye.
LTFPH.
Okay, and then cover your other eye and then read it backwards this time.
HPFTL.
Okay, great job. You have 20/20 vision and all in your right and left eye and then both eyes as well. The next thing that we are going to do is we are going to do like a kind of more of a peripheral distance vision test. So I'm first going to wiggle my hands and I want you to see when they come into view. Tell me when they come into view.
Now.
Okay?
Now.
Okay? And now I'm going to have you cover your right eye. And then tell me when it comes into view.
Now.
Okay?
Now.
Okay, great. Next up, I'm going to just kind of take a look at your eyes overall. So first I'm just going to look at your eyes. Okay. The apparatus looks pink. No tearing or scaliness. No excessive pinkness. I'm going to open up your eyes a little bit. Can you look down? Good. Now I'm going to have you look up, to the right, and then to the, yep, there we go. And then this side, look down, now look up, now look to the side, and look to the middle. Great. All right, now I'm just going to take a look from the side of your eye. Just stay still. There's no opacities or anything on your lenses. This is really bright. Okay, no opacities on that lens either. Everything looks intact, no tearing or anything either. So I'm just going to have you look straight forward. I'm going to test your pupil area response. Okay. Pupils are 3 equal in Perla. The next thing I'm going to have you do is just kind of follow my light to the middle of your nose. Okay, good accommodation there. Okay. I'm going to test your corneal light reflections now. Make sure there's red reflex. Okay. The red reflex is in place there. All right. Next up, I'm going to have you follow my finger. I'm just checking for any nystagmus or kind of gaze deviations here. So I'm going to have you follow my finger up. You're doing a good job on keeping your head still. Okay, good. So everything looked good there. Your eyes don't have any extraocular movements, no lid lag, no nystagmus. Okay. So I'm going to cover one eye and I'm going to look at the other eye here, just checking for any deviations as well. Okay, no gaze deviation there. No gaze deviation there. Very good. All right, I'm going to turn off the lights here just so that I can assess your optic nerve and retina and things like that. So I'm going to quickly turn off the lights. Okay. Okay, so I'm going to inspect your optic disc. This is a really bright light, so I'm going to have you focus on a point in the room. So just stare at that picture for me. Okay. I'm going to look at this side. Okay. All right, so your optic discs look really good in both sides. They're yellowish orange. There's clear defined margins. The physiological cup is smaller than the optic disc. That's very good. They were symmetrical on both sides without any papilloedema. The retina also looked really good. I was able to see your arteries and veins. There was no like massive palpitations in those. There were no lesions, masses, or hemorrhages. All right, so your eyes are really looking pretty good. So next up, we're going to do your ears. So first I'm going to kind of take a look, just looking around here for any masses or lesions. Okay, I'm not seeing anything. Now I'm gonna really palpate and just make sure there's no sensitivities. Are there sensitivities anywhere on this one? Okay. And then what about on this one?
No.
Okay. Now I'm gonna take a look into your ear canal. Okay, so that's clear. Now I want you to stay really still for this. I'm gonna get this in good position here. Okay, your tympanic membrane looks really good. It's gray and pearly. No swelling or redness on that side. Next up, I'm gonna do it on this side as well. I'm just stabilizing your head here. Okay. All right, so both ear canals look really good and both tympanic membranes are intact. Next up, we're gonna do a hearing test. So I'm going to have you cover and plug your right ear, and I'm gonna whisper a word in this ear, okay?
72.
Okay. Now on this side, plug your left ear.
72.
Okay, so hearing is intact. She was able to repeat the words. Next up, we're going to be testing your hearing. So I'm gonna make this kind of vibrate, and I want you to tell me if the vibration is equal in both ears and when it stops.
Equal.
Okay. Now I'm gonna do it on each ear. So I want you to tell me when it stops, and then it will kind of test it outside, and you tell me when it stops as well.
Stopped. Stopped.
Okay, great job. Now we're gonna test this ear.
Stopped. Stopped.
Okay, great. So that was your Weber and Rinn testing. Those were both normal. You were able to hear symmetrically. So next up, we're gonna assess your nose and sinuses. Have you been having any trouble? Okay. Any pain when I do this on your nose?
Mm-mm.
Okay. I'm not seeing any masses or lesions that are concerning. I'm next gonna check your nasal passages, make sure they're nice and clear. Okay. Very good. I'm going to have you like occlude one nair and breathe in. Okay, that sounds very clear. And then the other one. Okay, very good. Next, I'm going to test your, kind of just palpate your sinuses. Let me know if there's any tenderness.
Nope. No.
Okay, very good. Okay, next we're just going to do your mouth and throat. Your lips, they look nice and moist and pink. Good coloring, no dryness or scaliness. Next, I'm just going to have you open up your mouth and just say ah. Okay. Your mouth is pink. Oral mucosa looks nice and moist. I'm going to have you stick out your tongue and move, just stick it out midline. Now move it to your right. Okay, and now move it to your left. Very good. So there's no white patches or anything on the sides. Teeth look nice and clean. There's no swelling or ulcerations of the gums, no patches or any signs of decay or caries. Next up, I'm going to test your hard palate and soft palate. So I'm going to have you open up, and I'm going to use this just to kind of depress your tongue a little bit, okay? Say ah. Okay. Hard palate is intact, and uvula is rising midline. Tonsils look really good. There's no swelling. Your pharynx is not red. It's just nice and pink. And there's no lesions on your tongue or anything. You're able to stick it out midline. So very good. Overall normal exam. Next up, we just are going to do one last thing. We're going to be testing your lymph nodes. So So let me know if there's any tenderness or anything when I'm doing this. I'm testing your preauricular, your postauricular, your occipital here, your tonsil, submandibular, submental here. And next I'm kind of going to move down to your neck. So this one's your superficial clavicular, your posterior clavicular, supraclavicular here, and then your infraclavicular. I'm not feeling any abnormalities in your lymph nodes, no swelling in any of those locations. Thank you for coming in today, and I hope you have a good day.
Thanks, you too.